Welcome back to Fallopian Files, a visual podcast about all things woman for all womankind. I'm your host, Christian C. Today, I am so excited because we are joined by Dr. Denise Jagroo, who is a board-certified clinical specialist in women's health physical therapy. Now, we are super excited to have her today because we want to talk about the pelvic floor. Okay.
Yes.
And this is an area that is, it impacts so much of what most women go through on a daily basis and is not widely talked about. And you really don't know where to go. And I know for myself, I'm always telling you guys how old I am, being 41. I have definitely experienced things like having to run to the bathroom because I feel like I need, the grippers ain't gripping the way they used to, or you feel like the urgency with urination or things like that. And they're always telling you many other things that you could possibly connect those symptoms to, like having had children. If you're a mom, they just tell you should expect that you're going to be peeing on yourself. Or if you are obese, overweight, like similar, because I'm assuming because similar, the pressure on the floor is a similar reason why you would have that. Or if you have diabetes or things of that nature, there are definitely different clinical things that you can go through that could cause something like a frequent urination. But a lot of times it's just you don't have proper pelvic health, I think. And so that's why I wanted to have you on to help me, but help us all in terms of learning, what does a pelvic floor physical therapist do? When should we call one? What types of symptoms or anything should we look out for? Just all the information.
All the things.
Yes.
All the things.
So I'll let you introduce yourself a little more if there's anything I missed. And yeah, tell us about the pelvic floor.
Yeah. First of all, thank you so much for having me. I'm so honored to be here. And I love talking about all things pelvic floor. So this is fun. I love educating women. I feel like women and men, it's not just a women thing. Men have pelvic floors as well, and they have pelvic floor issues as well. But today we were talking about women. But, so I am a pelvic floor physical therapist. I've been a physical therapist for 23 years. I've been specializing in pelvic floor rehab for 16 years. I'm also a professor at a university at NYU, so I also teach this. I also have a private practice as well. And so I've been doing this a long time. And, there's just so much to talk about. And like what you talked about, it's still just little snippets.
Right.
Like there's so much more to it. It is so complex. There's a lot that we do. I think people think about pelvic floor PT as, something you do or you go to if like you're peeing when you sneeze and that's it. And there's just so much more to it. And there's so many different categories and symptoms you can feel and help that you can get if you need it. But we can talk about that today,
Yes.
because there's so many different layers to this.
Yes, yes. So help everyone kind of understand when we say pelvic floor, what does that mean?
So pelvic floor, what people I think are referring to when they're talking about the pelvic floor is the muscles, but it's really like a whole complex like compound structure, right? So there's like connective tissue, there's ligaments, there's tendons, there's all things going on in there. But when people talk about pelvic floor, they're really they're referring probably to the muscles. And there's layers and layers of muscle that work as a unit. So people think of like Kegel, right? They think of like the Kegel muscles and the Kegel exercises, but
I feel like that's the only thing they ever told us to do.
Right.
Is Kegels.
Right. And fun fact, Kegel is a dude. It's a man, right? I know. So
Really?
It's Arnold Kegel is a gynecologist in the 1940s who identified like the exercises to strengthen these muscles, and so they called it Kegel exercises. I'm like, of course, something that had to do with our pelvic floor, named after a dude. But so that's what they call it, Kegel exercises or Kegel muscles. But the Kegel muscles that they're referring to, it's really just the deepest layer. It's like these big sheets of muscles, but there's layers and layers, right? So there's like a superficial layer that connects to the sexual functioning organs because these muscles also contribute to sexual functioning. There's also deeper layers that wrap around the base of the bladder. They wrap around the rectum. So they directly contribute to bladder and bowel functioning, right? So either you're weak and leaky, or like you have trouble going to the bathroom and you're straining, right? So you're constipated. And then there's deep layers of muscle, and these are sheets of muscle that support the pelvic organs. And what are we talking about with pelvic organs? The uterus, the bladder, the rectum, right? So it supports it from underneath, but it also attaches to the pelvic wall. So it's contributing to stability, like postural stability and alignment. Like there's just so many things, but it's not just one of these muscles that are contracting one at a time. It's everything contracting all at the same time. And women and men have the same muscles. They're just positioned differently, but they do the same things. And so there's so many things that can go wrong, right? Because these are intimately intertwined, all of this, right? You've got nerves, you've got the lymph vessels, you've got, blood vessels, you've got the visceral organs, right? So it can affect sexual functioning, bladder, bowel functioning. It can affect just like if you fall.
Yeah.
If you fall and like you hurt your tailbone, right? Like there's 3 of these muscles that connect right to your little tailbone, right? So like it could be tight.
This
can
tiny
be
tailbone.
Tiny tailbone, right? Which is a residual tail. Fun fact, right? Evolutionarily speaking. So it's tiny, but like they have long names of muscles. It's like iliococcygeus, pubococcygeus, or coccygeus. I don't know exactly how to pronounce it, but they connect right to this little bone, right? So then people say they have tailbone pain, but it's not really like people can't really fall on their tailbone. It's so deep, right? But it's these muscles that tighten up, right? When you have like some kind of trauma, if like you fell, and they're pulling on the tailbone, and then the tailbone is not allowed to move. Tailbones move, right? When you deliver a baby, it needs to extend. It has to move out, right? When you have a bowel movement, it needs to move. And if the muscles are holding it tight,
each time?
Each time, yeah. So it has like, 20, 30 degrees of movement, but it won't move if it's stuck, right? Because everything's tight. So like it affects everything, right? So you can have pain, you can have like weakness, and they'll present different ways.
That's okay. So that's a lot of good information.
Right?
And I definitely, the areas when you're talking about, it makes sense when you're saying, okay, so it affects the sexual organs. It also affects the area around your bladder, your urethra, your anus rectum situation. So when you are experiencing symptoms, like what types of symptoms should someone say, okay, I'm experiencing this, maybe I should have my doctor refer me to a pelvic floor physical therapist, or or is there like a general time in your life when you should just automatically go and see one? Like when's a good time, or what types of symptoms should women look out for?
I think people should just go see a pelvic floor PT. I think everyone has like some kind of issue, and they're not talking about it. Nobody's talking about it, right? Because this is, I know it's embarrassing. There's emotion in this, right? And people, it's not like you hurt your knee and you can't go up the stairs. There's emotion in that. But like when you can't be intimate with your partner because you have pain with intercourse, or you're not going to your kid's graduation ceremony because you don't know the fastest exit to the nearest bathroom, like it becomes emotional. It affects their social life, right? Because they're not going out, because maybe they smell like, if they're leaking gas. If you leak gas, you're fecally incontinent. If you're leaking urine, it will smell. So people have this like kind of embarrassment, this shame that attaches to it, this emotion that attaches to it. But I would say that there's 2 categories. Either you're weak and you're leaky, or you're in pain, right? So if you're weak, you're probably leaking urine, incontinence, or you have maybe like a prolapse, which is like a dropped organ, or you're in pain. And pain is, you're having pain sitting on like hard surfaces, you have pain with intercourse, or you have problems going to the bathroom, like voiding. So like maybe you're constipated, or you have trouble emptying your bladder fully.
Oh, okay. So that's good to know, because a lot of times you think, okay, I'm constipated. I haven't had enough fiber. I'm not drinking enough water.
Right.
Or things of that nature. Or maybe I'm having frequent loose stools. Like, do I have IBS? Like, we always jump to the more extreme things. You'll end up, going on down the Google
Dr. Google rabbit hole.
And next thing you know, you've diagnosed yourself with so many issues.
Right. Everyone has cancer in the end.
Exactly.
Right? It's a tumor.
That's
No.
what you think. You're like, I got a tumor. Things are
Yeah.
breaking down. I'm not
Yeah.
like I'm gonna need an ostomy bag in a minute. Like you just start taking yourself down this whole
and a lot of times it's just a muscle that's tight, that's pulling on the rectum, that's not allowing you to pass stool
to fully
freely.
Wow.
And it's just, sometimes you're just stressed.
Yeah.
Like some people just have like a type A pelvis, like they're just holding their tension in their pelvis. Some people hold it here.
Yes.
And they wear their shoulders as earrings, as we say, or they hold it here. And that's like a really popular spot for holding tension.
Yeah.
And when you're holding tension there, the muscles don't like that, you know, so the muscles are on guard all the time. And when it's on guard for a long period of time, you get trigger points, you get spasms, and that's going to affect everything, right? Because it's all the muscles, right? So it's like it's wrapping around the vaginal canal. The muscles are wrapping around the rectum. The muscles are wrapping around the base of the bladder. It can affect all of that.
And that makes sense because you hear a lot of times people will say, especially when you talk about trauma or trauma related things, that especially as women, that we tend to hold our trauma kind of in our pelvic region around our reproductive organs. And that tends to be where we are, tight, or like you said, or having difficulty with urination, bowel movements, beyond just sexual intercourse, all these other symptoms as well. So that's definitely something that I would say in my course of time talking with other women, a lot of women will talk about those types of issues that they feel when you have somebody like really close, comfortable that you can talk to, but not just general conversation, which is interesting because like I have taken notice recently how comfortable we are with commercials for Depends, telling you if you sneeze and a little urine comes out, just put this specialized pad in your pants to help, and maybe you won't have embarrassment of leaking showing up or odor or things of that nature, like you said. But why don't we have commercials saying, or go to your pelvic floor physical therapist? Why spend money on these pads, basically not even treating the symptoms, just catching the residual aftermath of the problem, as opposed to actually treating the problem. So it's interesting just kind of hearing that and seeing that that is a trend that's kind of out there.
Yeah, I mean, it's a multi-million-dollar industry, right? The incontinence treatment industry, the pads, the surgeries, all the clamps, all the things, and like just sending someone to a pelvic floor physical therapist for even just education. Like, some people can feel intimidated because, yes, we do weird things in pelvic PT. There are devices that look a little funny, but it doesn't have to be that, So much of what I do that's effective is behavioral modifications and patient education. Just letting people know that, like, when you drink lots of coffee, you're going to go to the bathroom a lot because caffeine is the number one bladder irritant, right? Or like people just don't know that something carbonated, something bubbly and fizzy is going to irritate the bladder. Like you were talking about going to the bathroom often, right? And sometimes
I drink a lot of carbonated waters too.
Right. And so people don't realize that there's bladder irritants. It's irritating the lining of your bladder, and if it's irritating the lining of your bladder, it's going to make you feel like you have to go to the bathroom when you don't have to go to the bathroom, right? So it's firing off those signals in the wall of the bladder to your brain saying like, oh, you need to go. And then it's a behavioral decision to get up and go where you don't have to, because the job of your bladder is to store urine, right? So people get in the habit of going often, but it starts with drinking caffeine, drinking something carbonated, right? Drinking something acidic, drinking alcohol, drinking something citrusy. And people be like, well, I love my orange juice. That's really good for me. And I'm like, okay, well then accept that you go to the bathroom. Or like coffee. People get like so saturated that, they're so addicted to their coffee. So they go often. And, this one lady, she was like, I drink like 10 cups a day. And I was like, okay, well, do you see anything else besides like your bathroom floor tiles? Because you're always in there
all the time.
And, and she cut down and she realized it made a huge difference. And people sometimes just don't realize like a little change, a little difference in their habits. And a lot of times it's unlearning a habit, which is so difficult. as people get so like steeped in their habits and their
Yes.
routine. It's just changing something different can mean so much for quality of life.
Yes, yes. So if you are experiencing something like urgency, frequency with urination, or you're having issues where you're incontinent of your bowels, or having too much constipation, what how does someone get to a person like you? Like, how would they get to the physical therapist that specializes in pelvic floor? Like, does that come from your primary care doctor, your GYN? Like,
You can just find a pelvic floor PT and you can make an appointment.
oh,
You
okay.
don't really need a referral because we have doctoral degrees and like we have direct access. So you don't need, in most places, you don't need any kind of referral. You could just make an appointment. And there was and so even if you don't have, because there's not a ton of us, right? And there are some cities like New York City, we have like a pretty decent concentration of pelvic floor rehab therapists. But some rural areas, some towns, cities, like they just don't exist because it's not super popular. But a lot of us do virtual. So you can always do like a consultation with a pelvic floor physical therapist. And like I said, a lot of times it's just, patient education, behavioral modification, just learning these little things can help someone. And we can always recommend different devices. There's so many things on the market now, especially devices that wirelessly connect to your phone, and you can download an app and you can
Really?
insert the sensor. It does involve usually inserting something, but
Right.
and then it gives you a lot of feedback and it's like interactive, and there are things like that exist that we can bring to your attention and say like, you can get this on Amazon or whatever. And so just like talking with a pelvic floor physical therapist and saying like, is this normal? Is this not normal? Like, what can I do for it? Can help.
Yeah.
And a lot of times quell fears and just make someone feel a little more comfortable about like the possibilities of intervention and treatment and getting better. Because people definitely feel hopeless with a lot of this stuff. It's very emotional, especially
Yeah.
with things like sexual dysfunction, pain with intercourse, because it's affecting intimacy in their relationship and their marriage, and like things just start to crumble because people don't want to talk about this. People don't know that there's help. People, and we can go into a whole other conversation about like gender disparity and healthcare, and like how women just don't even seek help, and like how many percentage of women don't just deal with their issues
Yeah.
and think that like there isn't help, or they're not worthy. And that's like deep, right? To be like, you are worthy of going to a doctor to get something checked out and making your health a priority.
Exactly.
So that's a whole other
Exactly.
conversation. But I mean, this is the problem.
Yeah.
Women not seeking help too.
When you're saying about how it can affect sexual function and things like pain with intercourse or things of that nature, like what types of like how are the muscles impacting sexual function? Like, is it just that that there are women that are maybe too tight, or just feeling like your organs aren't able to move the way they need to move during intimacy? Like, what types of kind of signs and symptoms do you see frequently when people come to you for things related to their sexual function?
It's super layered, right? Like sexual dysfunction is complex. It's layered. You're dealing with a lot of the dynamics in the relationship as well. But if we're talking about just like the physical symptoms, there's three different places basically. Someone can feel someone born female can feel discomfort during intercourse. So it could be like on the outside in the vulva, the external female genitalia. They can have pain like upon entry, right? So that can be from like irritation, of the skin on the outside. It can be from they can have like an allergy to their partner or to the condom or something, and they can react, right? There's so many things it can be. They can have pain along the vaginal canal, and that can be from tightening of the tissue, tightening of the muscles around the vaginal canal. There can also be like a deep abdominal ache with like deep penetration. So that can be reflexive spasming of the pelvic floor muscles with deep penetration. So, and I would treat that all very differently. But I always ask patients, like, where is it? If it's just, is it just pain with intimacy, like where is the pain? Because those require very different treatments.
Right.
And there's lots of different tools and things that we use. But even before we get into that, like I always ask them about like, is this, you know, how is the relationship with your partner? Like, how is the communication? Like, do you feel, you know, and I'm also like a certified sex counselor. So I ask all these
many hats that you wear.
So I ask all these questions. Like, is it just, you know, when you're intimate with your partner, or when you're you know, having a party of one, you know, like, is it when you're with yourself or using toys, or, you know, is it also, because then I'll know if they can feel pleasure just with themselves and the pain only comes on with their partner, it's deep. Like there's something else going on.
Right.
It's more psychogenic. So, you know, they maybe need counseling, whatever. But if they having pain across the board, then it can be something physical. It can be that the muscles are tight, they're spasming, they have trigger points. It could be from trauma back in the day. They could have like tight hips, and because they have tight hips, they can't get into certain positions, and you know, their muscles are like compensating. It can be that they have neuralgia, which is an irritation of the nerve in the area. It can be that they have adhesions from a pelvic procedure that they had. It can be, and that's like pulling, you know. It could be that the muscles have spasms or trigger points, and like certain areas are like just point tender, like in certain positions, and but they can't get to it, right? Because it's like on the inside.
Yeah.
And so that's why we use all these tools to help like get to the inside. They can, like I said, have an allergy. It can be something with their like pH, you know, like, I mean, there's so many things. And that's what I love about it too, is like, you have to be, you know, pelvic PTs, we are detectives, you know, because we're trying to figure out, there's so many different systems that are interacting here and at play, and I have to figure out like, which system is it, or is it just that they're really not comfortable with their partner and they're performing and it's their duty, and they feel like if they don't perform and like go through pain, then their partner's going to leave. I mean, it's so deep and it's so complicated.
Very layered.
And you know, we deal with a population steeped in trauma, so it can be, you know, just a very complex condition, population, and it's just trying to figure out which questions to ask and try to feel out the patient and try to like understand the reactions. I don't like to have the partner in the room that changes their answers. You know, I feel because I don't know if it's the population that we treat, and it just like they, you know, they have a lot of trauma and they will act differently in front of their partner, because a lot of it is to please the partner. And you know, it's deep, because I go into this whole like program with them. It's called Sensate Focus, and it's like trying to, you know, show them that they are worthy of pleasure, like, you know, sans a partner, like just on their own, and that's deep. And then, you know, and I'm not a psychologist, so I have to do this within the scope of my practice, but it's like getting them to understand that like they deserve pleasure. It's not just about like giving pleasure or a duty, you know, and that can be all social. It could be familial. It could be like the messages they received about sex growing up, you know. It's just really layered.
If they receive messages at all.
Right.
Because that's something we see frequently with women, is that a lot of times this information, conversations are not had. They're not had within the family. They're not had between mother and daughter. They're not had between aunt and niece. They're not had between cousins. You know, there's so much information that you can glean from other women, and just hearing and knowing the circumstances that what you're experiencing may not be abnormal, or it may not be something that only you are going through. It's something that others could be going through as well. And having the conversation lets you know that, okay, this is what has happened. Here's how we can be treated, or how we can seek help. And it's big, like you were saying, how interconnected everything is, because it's not just always physical. Sometimes it is psychological or emotional, or, you know, so being connected with a provider, and, you know, things like your pH being off, like you said, you know, are you seeing a gynecologist regularly, and having, you know, examinations and tests done, so that if you are dealing with something that's an underlying, you know, disease process, that you're actually treating the cause of what's happening to you, and not just either treating the symptoms or ignoring it, you know, with waxing and waning symptoms. So yesterday you were, urinating all over the place and today you're fine. So you're like, oh, I don't need to be treated. But no, you should really find out why were you urinating all over the place yesterday, um, and knowing, STD checks and things like that, because if you don't have those treated for many of them, and you end up developing like a pelvic inflammatory disease where you're having more scar tissue develop and injury to all of those organs, then you're not really treating what the cause is. And then now you're developing more issues coming up as time is going on. So I think that's like huge that you're bringing up how interconnected everything is, and just kind of giving us more providers really that we should have in our Rolodex that we're seeing. It's not just your primary care doctor if you have one, which you should. I'm going to reiterate that almost every episode. Okay. Have a primary care provider, have a gynecologist. If you have, a uterus and a vagina, you should have a gynecologist. Whether you identify as a woman or not, if you have those organs, you should be seen. Just because there's so much health-wise, especially, and if you are in a population where you are going through transitions and taking hormones and going through different types of surgeries, that's even more of a cause to be able to connect with a pelvic floor physical therapist, because of so much that many of our brothers and sisters going through transitioning are experiencing as well. I know sometimes you need assistance with expanders or things like that. So have you seen that type of situation, or have had those types of patients where you need to provide that type of care as well?
Yeah, I've had patients who have had bottom surgery, and there's different devices that are on the market to help with stretching post-op and many months post-op, because there's a pretty intense stretching regimen that they have to be on. And so they have to, like 3 times a day for a certain amount of time. And that's a lot, especially like trying to have a discrete device, like stretching the tissue so that it doesn't like adhere and close back up. So, so we help with education, with recommending devices and consultation for patients who are transitioning. Yes.
And when you're talking about devices, because you said devices frequently in each of your areas, where if you need to do that type of intervention, when you're saying devices, what does that look like? Is that all invasive? Because I would probably envision, like a very scientific, scary looking vibrator.
Yes, but the pretty colors, they come in pretty colors. There's so many different things, and it does not have to be a part. Patients, they say they're intimidated, they're scared about pelvic PT. It doesn't have to be that. It doesn't have to be that you have to even have an internal exam. Like so much of what I do, and because we have such a trauma heavy population that we deal with, a lot of the work that I do is moving patients through to being just comfortable with their bodies and connecting with their pelvises in general, especially if you have a history of trauma. So you cannot move forward unless you like connect with your body. So we do a lot of breath work, we do a lot of like meditation, a lot of like mind body calming techniques, a lot of just getting in tune with the body to like move forward. There are devices that you can insert. There are a lot of things on the market, like I said, that wirelessly connect to your phone, so they can give feedback whether you are contracting your muscles correctly, if you are at all contracting your muscles. There are devices that you can insert like wands, and they help with releasing trigger points, and they help with exploring. Really, I use it to help the patients find. Sometimes they don't know. They'll be like, oh, I just hit a spot that like it feels so good to use this device to get to it because I can't reach it otherwise, because it's like you can access like deep hip rotators like through the vaginal canal, like with some of these devices. And then some people have trigger points that they can't get to. You can't get to. And so with these devices you can. And then they do different things. Some of the devices, like they vibrate. Some of the devices, they hold temperature. So like if you hold it under the faucet. You know, it can be cold because some people are really irritated in the area, and it could be male or female. It could be like for rectal or vaginal therapy. And so it could be cooling, or maybe people just need a soothing warmth to like help bring blood flow to the area, to help heal and calm the area so it can hold, you know, temperature. There's all different things. There's vaginal weights for strengthening.
I've seen some of those
Yes,
before.
yes.
Actually, I think I bought one time.
Yes, yes.
Yeah.
And it's for strengthening. Like, how else do you get strength? I mean, there's other ways to strengthen, but like, you know, with a weight inserted, you know, they look like little weighted tampons, and they're different colors, and they're pink, and they're pretty. And so you can insert them and then do different exercises, but it's really about building awareness and like connecting to the pelvic floor, because you can't strengthen it, you can't relax it if you don't know where it is. So you need to find it first, and it's on the inside. And we can't see it. And like nobody, like everybody says like, oh, I Kegel, I do my Kegel. Nope, nobody is doing these exercises properly, because people are squeezing their butt muscles, or they're squeezing their thigh muscles, or they're sucking in their stomach, or they're holding their breath. And people, like, I literally had, that's a true story, in all my like 23 years, the only person I ever had to like get these muscles to contract like really strong and like have a really good isolated contraction was this like old Russian grandmother who was like amazing. I was like, this is incredible.
She was like, I got this. Don't worry.
She had like, she's the only person ever. And everyone else like is doing all other things, you know? And it's about like building that awareness so that you can isolate the contraction and have like an accurate, you know, strong isolated contraction. And that's hard, and it takes time, especially if you've had an injury, especially if you're not in touch. Like, women are just generally more in touch with their pelvic floors, you know, than men. So like men, it takes even longer, but for women, you know, for everyone, like it takes time to build that connection, build that awareness. And especially if you've had trauma, you've disconnected from the pelvis, and it's like a journey to like reconnect and like own your body again. And, you know, so like a lot of pelvic floor therapy, you know, it can be light, but it can also be very heavy, you know, but like seeking out, you know, I think, like I said, I think everyone should see a pelvic floor physical therapist. In France, it's included in postpartum care. It's like 6 to 12 sessions that you get with a pelvic floor physical therapist, which I think should be standard everywhere, because women need it. Just like, you know, even if they don't want to do all the internal stuff, which you still need to wait postpartum to do, like just, you know, scar management after C-section, just, you know, posture, alignment, breathing after giving birth, what's safe to do, what's not safe to do. Oh, that's another category, because I said just weakness or pain, but we do labor and delivery prep. You know, for pregnant women, we treat pregnant women who are experiencing pain, or we just do like pain prevention, you know, like preventing dysfunction during pregnancy, and then postpartum care. So there's so much that we do. There's so much that we can educate with bracing, with like cushions, with like posture and alignment and body mechanics, and, you know, like how to manage yourself as you're getting bigger, as you like have the baby, how to carry the baby, how to breastfeed. There's so many things.
Yes.
So
I'm so glad you brought that up, because I was definitely going to ask about pregnancy, postpartum. I've had a few people, when I told them that I was going to be talking to a pelvic floor PT, they were like, oh, thank goodness, because when I had my baby, now I've got all this different stuff that I'm dealing with. So when you're talking about, especially related to pregnancy, like either pre-pregnancy, during pregnancy, or postpartum, like, are there certain things that you would recommend people do, even if they haven't connected with a pelvic floor PT, that they could do at home, maybe to try to prepare themselves for the process of carrying a child and the weight that puts on your pelvic floor?
I mean, I think even if they're not physically going to see a pelvic floor physical therapist, to like look for information on how to, and I usually don't do anything internal with a pregnant patient. So it's education that you can, and information you can get, you know, either from a pelvic floor therapist, like online, or do like a virtual consultation or something, but to keep the pelvic floor strong, you know, during pregnancy, because, it's continually taking a heavier beating like throughout the pregnancy. And then, there could be so much trauma during birth, during labor and delivery. So keeping the pelvic floor strong, and then you can go right into pelvic floor strengthening, like right after delivering. You don't have to. And that helps with healing and bringing blood flow to the area to help with healing, helps with the tone of the muscle, keeping it healthy. But one thing also that women are always asking about during pregnancy is like how to prevent the splitting of the abdominal muscles, because that is so hard to rehab after delivery. So that splitting is called diastasis recti.
How common is that to have that splitting of the
I don't have a
abdominal
percentage for you, but it is super common. And it's not that you did anything wrong. You could be, very small and carry very large and not have it. It really is about the genetic predisposition of the person, like the quality of their collagen. It happens more to people who have a history of rolling their ankles or like pulling muscles. They're just kind of weak in that sense. But it can happen to anybody. And you want to prevent that. Like I said, it's called a diastasis recti because there's a connective tissue structure going down the center of the abdomen, and it softens during pregnancy, and it can separate too much, and then you just don't have that stability in the low spine. You don't have the support and or protection, right? So it's really hard. It's supposed to come back together after delivery, but sometimes for some people it doesn't, and you need to bring it back. You need to bring it back together. And people think, oh well, I should just go get surgery, and we always want to do conservative management first, right? There's exercises you can do, there's bracing, there's body mechanics you should know about. So that's one thing.
That's a big one. I've had some friends who have dealt with that after having multiples. So a couple people I know who've had twins and ended up having that separation. And sometimes they will wear a lot of what we look at as like waist trainers or girdles, fajas, whatever, things to just kind of hold the abdomen tight, because when they you could see some to the point where if they were laying down, you could almost fit your whole fist in between their abdominal muscles, because they were so stretched apart in terms of that, and just all that entails from having that. And for some of them, their only recourse that they were talked to about was having the surgery where they essentially kind of stitch your abs together, so that they can be secure and back together in that way, but then has its own set of complications.
Think about like how intense that is. And that is hard to rehab from. That is an intense recovery period, because think about what they have to do. It's not just stitch. First of all, you have to qualify to have the surgery, which means you have to be done having your kids, and you have to go through pelvic floor PT and fail it for them to consider doing this, because it's a big surgery. And it's not just, pulling everything together. They cut, from this hip bone to this hip bone. They pull up, they pull this together, they sew this together, but then they pull the skin and they cut the skin, which is an abdominoplasty, right? Because they're cutting the excess skin, which is plastic surgery that you have to pay for. So the medical part of pulling the muscles together, that is, that could be covered under insurance, but then the abdominoplasty part is not. And it's an intense recovery. It's an intense surgery. And I think people can do really well in therapy if they just try the therapy first anyway. And then learn ways during pregnancy to prevent that from happening,
That's big.
And which brace is correct, because you don't want to wear just a binder, just a generic binder, because that's not really pulling the borders of the muscle together.
Yeah. No, that's huge what you're talking about, because I feel like these days you get a lot of people who they see a lot of celebrities doing these mommy makeovers. They've had their babies. They, flew to insert here and got things done, nip tucked, new hips, new butt, and then came back. And it's but did you actually, take care of whatever was causing the need to have, if it's just all aesthetic, to each their own. Now, don't judge anyone's decisions if you want to feel better about yourself and how you look. post pregnancy. But if you're going because you've had, that separation of your abdominal muscles, or you're feeling weak in the pelvic floor, and you're like, well, let me just do the whole mommy makeover and that should hopefully fix it. It's, you're kind of skipping some less invasive steps that could hopefully strengthen everything, like you said. And then if you're doing exercises during pregnancy, like what types of exercises are really safe for someone who is pregnant that they could do even on their own, like outside of the physical therapist's office.
I mean, let's talk about what you want to avoid, right? So you don't want to be doing planking. You don't
Yeah.
want to do, like, I see a lot of pregnancy classes and like exercise classes, yoga classes, where they're in quadruped, which is like hands and knees. And you want to be careful with that, right? Because like it's a softened structure, and then you have like the baby, right? Like pushing through that, and you've got gravity helping it,
Yeah,
right? So
yeah.
like if you are going to do something on hands and knees, like a very short amount of time in that position, few repetitions, you don't want to stay in that position because you don't want to create a diastasis, which is the splitting, right? So you don't want to be doing sit-ups. There are ways to strengthen the pelvic floor and the abdominals safely. There are different things you could do, like in standing, like with squats, different exercises in side lying. There are different things you want to do with weights. And I know there's just like I always say, when I was growing up, like people were overly cautious. Like people didn't want to exercise at all. And
Yeah.
there was this like old school limit of like, don't let your heart rate go above 140 beats per minute. And that was like based on nothing.
Yeah.
And like, so they don't follow that anymore, right?
Yeah.
But like now I think there's a push to do too much, where like you see like trainers like pushing their pregnant patients, or like the celebrities, or like the marathoners or whatever. And it's like they're doing like heavy weightlifting or doing too much, and it's too much, right? Like you should be able to maintain a conversation like when you're exercising. I always say bring a buddy. So make sure that you can talk without gasping for air or overheating. That means you're doing too much. So take it down a notch. Like you don't have to worry so much about the limit of heart rate, but if you cannot speak, because you're doing too much, like I call it the talk test. So I said, like, if you can't like say a sentence without like getting through it, you're doing too much. Like if you're doing weightlifting, and I think, a certain level of weight is okay, but you have to think there is a hormone going through your body called relaxin. Ideally, it would just go through your pelvis at the end of your pregnancy to allow the pelvis to open up and allow the baby to drop and be delivered. But it spikes throughout the pregnancy. So it's acting on all your collagen, right? So all of your ligaments, your joints, they're a little more loosey-goosey, right?
Okay,
So like
okay.
you're more prone to, rolling your ankle. You're more prone to like straining something or spraining something, just having pain in different areas. So like for you to lift the same amount of weight, like people are always like, well, I'm a gym rat and I'm going to do blah, blah, blah. I'm like, you're not the same, especially when you're pregnant. You're not the same. You don't have the same like hormones going through your body. And then when you give birth, like you're still not the same. Like your body has changed, and it's okay.
Yeah,
And there's
yeah,
just
yeah.
obviously such a push to like be back in pre-baby shape and like be back to who I was, but you're a different person, and it's okay. And I wish there was more acceptance of like your post-baby body and stuff like that. So,
Yes.
if you're thinking about lifting heavy weights or whatever, like you have to take precautions, because your joints are just a little more susceptible to injury because of the quality, of the collagen and the hormone acting on it. Like if you're a runner, you can still run. I was running until I was 7 months pregnant, but then, I was like uncomfortable after that. But I also made sure that I was like on very safe terrain, like you can't see your feet after a while, and your feet are swollen, and like you gotta make sure you're wearing the right footwear and all that good stuff. So there's so many things to be aware of, and you're just not the same. You just can't carry on the same,
Right,
and people
right.
are really like there's a lot of push for that in the media and in Hollywood and stuff like that. And like I wish there's just more acceptance, and like we are different when we are pregnant and when we give birth, and that's fine.
Yeah. I love seeing, I feel like we're having a little less of that snapback movement that we used to see, where everybody wanted you to drop your baby and be back in the jeans you were wearing pre-pregnancy, if not smaller. I feel like we've started to see a few more celebrities, and it's unfortunate that it takes kind of celebrity culture for the general culture to change a little bit, but I feel like we're starting to see a few more celebrities accepting of the changes in their body post-pregnancy, which is allowing for other people to say, okay, maybe it's okay that I've changed a little bit here and there. But I definitely think, I agree, I feel like that snapback culture was not healthy for us, and really kind of set a lot of women in a mindset that was not very conducive to health overall. But so when we're talking about like the weight of the baby and everything that causes that pelvic floor weakening with pregnancy, is that something similar you see with obesity or people who are overweight, or how does being overweight impact the pelvic floor in that way as well?
I mean, you can have structural damage from this. It's prolonged weight, right? With the obesity, with the pregnancy, it's like towards the end of the pregnancy, right? It's not like, the first 3 months, people don't even know they're pregnant sometimes, you know?
Right.
And they're going to pop at a certain stage of the pregnancy. But with obesity, it's this constant chronic pressure and stress on the structures in the pelvis, on the input from the nerves, all of that can be affected. So this, that messaging system going back and forth from the pelvis to the brain. So getting that feedback, getting like the right signals going through, like all of that is going to be affected. So, not having that pressure, not just on your pelvic floor, but on your joints.
Right.
In general, like your knees and your hips, like all of that. And it's all connected. So, having less weight is always like healthier for the pelvic floor. Yeah.
Yes, that's real. Okay. So I want to ask you some things that you hear a lot, to find out if it's like fact or fiction, and is it really something you should avoid or not avoid. So one of the things, I know we talked about the Kegels a little bit. So in terms of the Kegels, are they actually helpful, even if people aren't doing them 100% correct? If you're even just trying, is that better than nothing at all? Or do you think it's best to really connect with, like a pelvic floor PT to find out how to properly do the contractions?
I mean, the whole basis of like what I do is like Kegels, right? It's like trying to engage the pelvic floor, like recruiting, being aware of the pelvic floor, and doing those strengthening exercises, or like, relaxing, of course, but you still need to engage the pelvic floor in order to relax it. So like we're always doing Kegels. Doing them wrong it's gonna hurt. Everything about it is gonna hurt, because if you're just squeezing your butt, like, and you're not getting the pelvic floor muscles at all, then you're just gonna end up with like, overworked butt muscles, right? And like and that's not gonna do anything for you, then you're gonna end up with other imbalances and stuff. So seeking out the help of a pelvic floor physical therapist is always number one, I say.
Number one. How about, so in our phone culture, a lot of us spend too much time sitting on the toilet scrolling. And there was a time they would tell you, do not just hang out on your toilet seat. It could be the one place in your house that you finally get some peace and quiet, but you shouldn't just hang out on the toilet seat. Is that something that is true we should not do, try to avoid, or in terms of your pelvic floor?
Yeah, in and out. In and out. And don't take magazines, your tablet, your phone, in and out. It should be like really like a quick experience. Like if you are like if you get in the habit of obviously taking technology in with you and spending time, like it's not like sending the wrong messages, right? Like you need the sphincters to release, you need like the muscles to relax, you need to void, and you need to be out. So like if you're spending a long time like constipated, or if you're just like dragging the time, like it's just not the right signals for your brain going to the pelvic floor about what it needs to do. So, and I do understand. I mean, I'm a mom. I get like the bathroom is peaceful space. Yeah. But like, do your business.
Some they still come in the bathroom.
Oh, yeah. I always have. I usually have company in the bathroom. But like, if you really should just like get your business done and be done
and get out of there.
Get out. Yeah.
And can you overuse the area if let's say you're one of those people that you don't have pain with intimacy, whether by yourself or with others? Can you overwork the area? Can you do too much stimulation for the pelvic floor.
Yeah, I mean, you could fatigue the muscles if they're overworking. Patients always ask if they should have the vaginal weights in all the time. Like, no, these are like little muscles. You know, you don't want to fatigue them. You know, they can have people who have trauma to the area. You know, you can affect nerves. You can affect the receptors and the sensors in the wall of the muscle. They can affect the signals going up to the brain. People can be desensitized. You know, people can be like overstimulated. It can go many different ways. You can have trauma to the fibers of the muscle, So a healthy balance, is what I
Yeah.
say.
Yeah.
They need to recover too.
Absolutely. Absolutely. So, at Fallopian Files, we are big on advocacy. I am huge in making sure that our community is sharing stories with one another, because remember, your story could be the key to helping someone else be able to get information or unlock something that they've been thinking about, or even they could give feedback to you that you haven't been thinking about. So just even in sharing your story with one other person helps to build and grow our community, and is going towards advocacy in a way even beyond just sitting in front of a microphone or a crowd of people and talking about these issues. So I definitely want to encourage you all to communicate with each other, to reach out to your providers, to, if you are in an area where you need a referral, asking for a referral to your pelvic floor PT. If you have, hopefully you're able to have health insurance. And if you are, go onto the portal for your health insurance where you can find the providers that are in under the coverage of your insurance, and look for a pelvic floor physical therapist to evaluate you. It may be that you don't need their input or intervention, which it sounds like that's not the case. Sounds like we all need their intervention. But at least having the conversation and being assessed in that way, if they feel like you need to be connected with other types of providers as well, like, for psychology, or going back to your GYN if there's something, infection wise that needs to be treated. Having as many professionals in your pocket as your arsenal, your little army to help protect you, is I think is better than not having anyone at all. And if you're experiencing things like that frequent urination, or issues with constipation, or issues around your sexual organs that you're having a hard time in either direction, reaching out to someone like Dr. Jagroo is going to be very is going to be very helpful, because we all do deserve to live lives full of pleasure, fun, having the least amount of barrier to being able to do anything. You don't want to have to avoid a trip or avoid an event or anything like that because you don't know how close you are to a bathroom. Like, these are things that a lot of women have just accepted over time as a part of aging or the woman experience, that it doesn't have to be. So having these conversations are huge to put out there so that we know exactly the information we need and how to advocate for ourselves. So, Dr. Jagroo, where can people find you if they want to get more information, if they want to reach out to you? Where are you on the socials? Tell us how we can get in contact with you.
I'm on all the socials, so I'm at Dr. Denise Jagroo, and my website is drjagroo.com. You can reach out anytime with questions, or if you just want to message me on social, check out my videos. I talk a lot about women's health, pelvic floor, give a lot of information as well.
Yes, we're going to link all of her information in the show notes. But please continue to like, comment, subscribe so you can follow along and on this journey to be able to get information out to each and every one of you. Remember to build a community, so have conversations in the comments. Let me know what types of topics that you want to discuss here at Fallopian Files. And we definitely are going to ask Dr. Jagroo to come back because we gave a very general conversation today, but I definitely want to dive into some of these topics to get deeper into them as we go along, and just really being able to share this information with all womankind, I think, is very important. So we're definitely going to have you back.
Love to be
And
back.
look forward to the continued conversation, everyone. So please remember to take care of yourself. And until next time, thank you for joining us here at Fallopian Files.